Hello everyone, I am Majid Rahman Oni, a fourth-year medical student of Usmle Medical College and currently preparing for Usmle Step 1. Okay, so today I want to discuss about two common problems of Usmle Step 1 from Uworld Immunology. So let's get started. Okay, so as usual, I will at first read the question and the option, and if required, the stem. Okay. So, at first, I start the question, which of the following substances is most likely produced by the microorganisms responsible for this patient's infections? Okay, so we don't know the clinical features of the patients. Okay, so we have to read the stem, right? So, at first, we go for the options. At first, the first option is beta-lactamase, second is catalase, third is coagulase, fourth is lecithinase, fifth is polysaccharide capsule. Okay, so let's go for the stem. Okay, so a 4-year-old boy is being evaluated due to severe and recurrent infections. Okay, so we know when we read the stem, we have to must see the keywords for our answer. Okay, for promptly seeking our answer. Okay, so at first we see the keywords here. We find a keyword that is recurrent infections. Okay, so he has been hospitalized 3 times with pneumonia since birth. So pneumonia. Okay, recurrent infections, pneumonia. So next is he has also had multiple skin infections. Okay, another one, skin infections that have required treatment with antibiotic and antifungal agents. The patient's neutrophils fail to turn blue, which is a major keyword for us. Fail to turn blue following exposure to nitroblue tetrazolium. It's a diagnostic base for disease. Okay, we will exclude it in next. Okay, in further fashion. Okay, so which of the following substances is most likely produced by the microorganism responsible for this patient's infection? So, what will be the answer here? So, here is a key point or keyword for us. Neutrophil fail to turn blue in exposure of nitroprotetrazoleum. We know nitroprotetrazoleum is a diagnostic test for a disease, which is chronic granulomatous disease. Okay, so what will happen here? So, which substance will most likely produced by the microorganism? And here, a substance or enzyme will produce. We know the names of the enzymes, and that is catalase. Okay, we'll further discuss it. Okay, so why the answer is catalase, or what happens in CGD, chronic granulomatous disease, or what is chronic granulomatous disease? Okay, so why not the other options is correct? So we will exclude it in further discussions. Okay, let's get started in our explanation. Okay, at first we go here that at first we see that a most common key points for us is that neutrophils failed or impaired to turn blue on natural tetrazoleum testing. So we know it's a characteristic of chronic granulomatous disease. Okay. So what is chronic granulomatous disease? Okay. So at first it's a X-linked disorder. Why it happens? It happens for the deficiency of NADPH oxidase. Okay. So what's the role of NADPH oxidase? We know about oxidase oxygen burst. Okay, so here the enzyme responsible for formation of reactive oxygen species in phagocytes. Neutrophils which are affected by this disorder, they can't kill catalyst producing organisms. So we have to know which organisms are catalyst positives. And we also know it that catalyst is responsible for converting the hydrogen peroxide into water and oxygen. Okay, so we see here what are the pathogenesis behind CDD. So the pathogenesis is in inactivating mutation affecting NADPH oxidase and impaired respiratory burst which inhibits phagocytic intracellular killing. We already discussed about it. Okay, we see some clinical features or clinical manifestations in the stem. So we have to know what are the clinical manifestation of chronic granulomatous disease? So here, recurrent infections with catalyst positive bacteria and fungi. Okay, so lung skin most commonly involve lung, skin, lymph nodes, liver, right? So diffuse granuloma formation, and here's the most important thing we have to know, that is the diagnosis, measurement of neutrophil superoxide production, which included NBT testing. Okay, then dihydrorutamine flow cytometry preferred testing. Okay, so we go for further explanation what happens in chronic granulomatous disease and why and what is the role of the catalase here. Okay, so at first we go for, okay, we already discussed what is chronic granulomatous disease, what are the pathogenesis behind it, what are the clinical manifestation, what will be the diagnostic or what is the diagnostic tests for chronic granulomatous disease. Okay, so let's go for further details of chronic granulomatous disease. Okay, so at first, what happens here that in case of inactivating mutations of NADPH oxidase, we already know the abbreviation or name for it, that is nicotinamide dinucleotide phosphate. Okay, so oxidase cause impaired intracellular killing by neutrophils. Okay, so, and macrophages leading to recurrent bacterial and fungal infections. Here, a question will be arise: why there is a recurrent bacterial and fungal infections? We know there is inactivating mutations in NADPH oxidase, which causes impaired intracellular killing. So that's why the microorganisms can't be properly killed by macrophages or or neutrophils. So that's why the recurrent bacterial and fungal infections occur. Now we will know already most commonly involves your skin, lymph nodes. Okay, so these infections are usually caused by catalyst positive organisms. Okay, so we can use a mnemonic for catalyst positive organisms, and that is we need for SS pen. As for Staphylococcus, as for Serratia, and the another pan for Pseudomonas, and A for Nucleidia, and E for Aspergillus. Okay, so the five organisms which are catalyst positive, which have catalyst enzyme, which can convert catalyte, which can convert hydrogen peroxide into water and oxygen by their own catalyst enzyme. Okay, so, in contrast, catalase negative organ enzymes can't do it. Okay, so you can ask me why the other options are not right. We know about beta lactamase is an enzyme which is produced that converts yeast into beta lactam antibiotics, most commonly used penicillin. Okay, so in an effort to overcome bacterial production of beta lactamase, penicillin is raised in penicillin. That means methicillin, oxacillin, and naphthalene and beta-lactamase inhibitor, clavulanic acid, tazobactam, sulfactam were developed. So as simple as that, you can remember it. Beta-lactamase most commonly used is an enzyme that converts yeast into beta-lactam antibiotics, most commonly penicillin. Okay, so let's go for the next option of our, that is lecithin. Again, we know it's a alpha toxin, mainly is an enzyme with phospholipid C activity and major virulence factor, which is produced by the Clostridium perfringens. Okay, so this option or this toxin will not related with our chronic granulomatous disease, catalyst, so our answer. Okay. So next, the polysaccharide capsule expressed by some organisms, we know the Haemophilus influenza, Streptococcus pneumoniae, it inhibits phagocytosis by macrophages and neutrophils. Okay, this is also not a correct option. It helps in the recognition of capsular antigen by immune system. So, so here we can see how we can exclude the correct answer and why other options are not correct. And we also know that how to properly go through our questions. Okay, you are how to properly solve by URLs. Okay. So next go for another common question. Okay, so Till then, thank you everyone.